Okay, this video is part one of a book review. Here's the book called The Garbage Collector by a dentist by the name of Robert Gammal. So Gammal, he's a really smart dentist. He's retired now, and again, the old retired guys write the best books because they're not afraid to tell the truth. And he went and practiced a little bit with Hal Huggins, who was the pioneer of amalgam removal and root canal removal for treatment of multiple sclerosis and other diseases. Okay, I'm probably going to do this in several parts, so this will be part one because it's a big, long book. It's like 400-something pages, a lot of information. And his website's really good. His website is realdentalinfo.com. He spent the first 13 years of his practice doing conventional dentistry, and then the last 27 doing the stuff he learned from Hal Huggins and other pioneers like Weston Price. And he actually went, like I said, physically studied with Hal Huggins in Colorado. Hal Huggins then had his dental license revoked, because he wasn't doing what establishment wanted him to. There's a quote from Justus Liebig, the German chemist. He said, "The acquisition of a new truth is like the acquisition of a new sense, because it renders a man capable of perceiving many things that previously were hidden from him." Yeah, once you understand. So, and also you might ask yourself, why am I so interested in dental? Because I had a reactivated cavity when I foolishly tried that sugar diet business just for curiosity. And then I started thinking I might have to get some revision on my tooth. And so I started reading all this dental stuff, and I'm like, holy crap, I should have studied this a long time ago. Dentistry is a disaster. It's almost as big a disaster as psychiatry. It's a disaster. Fluoride's a disaster. Mercury amalgams are a disaster. Root canals are a disaster. So it's worth knowing about because a lot of people, I think, they die because of dental-related illness, and they don't even know what happened to them. And I can also tell you, look at all these demented brains, and they almost always have bad teeth, really bad teeth. Okay, like no teeth at all. There are a bunch of periapical lucencies, mandibular and maxillary abscesses, periodontal, advanced stage periodontal disease. Okay, Weston Price, the dentist, famous author of Nutrition and Physical Degeneration, going to all the poor countries, seeing the people had good teeth if they ate the old-time diets, did a root canal on his own son, and his son died, and that really made him sad. And he was a genius researcher, and then he started studying root canals after that, and he realized, oh my God, it's a terrible procedure. You can never sterilize the tooth. He traveled around the world, like he went and looked at Aboriginal, Maori populations, all these ancient populations, Africa and other places, and they had good teeth if they just ate old-fashioned food. Fluoride had nothing to do with it. In fact, the populations with no fluoride in the water, they have better teeth. It's eating the bad foods, the refined flour and sugar that destroys teeth. There's a lot of sources of F- fluoride beside the fluoridated water. It's pretty high in some teas, in toothpaste, dental cleanings, etc. I've given a bunch of lectures on fluoride before, so you can watch those if you're curious, and maybe someday I'll visit that subject again. I'll briefly talk about it here, but clinical experience, also he saw just terrible side effects, and he also, in his own personal experience, Gammal, he was a dentist for many years. He's retired now. He graduated from dental school in 1974 in Australia, but he removed tons of teeth and saw people get better from removal of amalgams and removal of root canal teeth. There's a famous smoking tooth video on YouTube that shows you that mercury vapor comes out of the tooth. They set it up to show mercury vapor. Other exposures to HG include fish, other foods, air pollution. NOEL means no observable effects level of toxicity, and with mercury you can't even get to that. Even a minimal amount can potentially cause symptoms. It has no purpose in the human body. In 1995, a Canadian group said amalgam should not be placed in pregnant women, children, or patients with CKD, chronic kidney disease. When you remove amalgam, the body levels of mercury, they go down. So it's known. There's nothing ambiguous about it. Like I said, I forget who said it, but if there was money involved, people would dispute the law of gravity just because money controls a lot of stuff. In terms of tooth anatomy, the enamel is the white part that you could see in the mirror. Toughest part of the tooth. Once you dig past the enamel, you're into the dentin. You go past the dentin, which contains all the tubules, you're into the root canal, and then the little arteries and veins that come up from the bottom of the roots, and they maintain a positive fluid pressure through the dentin tubules to push fluid out of the tooth and prevent cavities. The little tip of the root apex is called the apex, the tip of the root, and that's where the arteries and veins and nerves enter. And then cementum attaches it to the periodontal ligament, which attaches it to the bone of the mandible and the maxilla. That bone's sort of rarefied. It's called alveolar bone. Periodontal ligament is, what must be removed when teeth are extracted. Okay, I've shown pictures of this. I've done other lectures on dental anatomy. We're just kind of going through a couple quick reminders here. And the root canals themselves, the anatomy of them is not a simple bifurcation, just like the upside down tooth classic picture you see. There's actually a whole bunch of little side branches, like a taproot for a tree. So the point is you can't sterilize them. They're always infected when you do a root canal. Okay. Okay, a little info on dental cavities. Basically, you don't want to eat sweet foods. You don't want to eat acidic foods like soda pop or orange juice. You want to stay healthy, because when you get atherosclerosis from aging and bad diets, you get less blood flow through your teeth and less ability to maintain a positive fluid pressure, pushing fluid from the center of the tooth outward back towards the mouth, towards the tongue and stuff. And that'll increase your risk of getting cavities. This guy, Ralph Steinman's the one who figured all that out. The positive fluid pressure pushing fluid out of the tooth. That's out of the tooth. And that's the most important thing to prevent cavities. So it's kind of a systemic issue. If you have good systemic health, like when I was young, I was real healthy. And I could eat all the candy I wanted on Halloween and forget to brush my teeth and I'd be fine. But as you get older, you can't do that anymore. Let's see what else. If you're stressed out, that decreases blood supply to the teeth because you're stressed out. You save your blood flow for your muscles, you vasoconstrict everything else. So excessive psychological stress, and then the equivalents are sleep deprivation and caffeine. They will diminish blood flow through the tooth. They'll drop that positive pressure through the dentin tubules, increase cavity risk. Weston Price showed that a cavity, it'll penetrate through the enamel, then it gets through the dentin, and once the bacteria get in the pulp space, they can spread through the blood vessels all throughout the body. The infection potentially can. And especially it's more likely if the person's immune system's weak, like they're elderly and debilitated. He does recommend you brush your teeth at least once a day. He wasn't a fan of any of the toothpastes. Ruth Heidrich just braces with the brush to kind of remove plaque on your teeth. I don't always do that. I probably should do that more. Always floss, especially at night, because you have less saliva production at night, so you don't get cavities. He says never use fluoride toothpaste. He said it has no benefit, zero benefit. He says the people with the healthiest teeth are the ones whose water is not fluoridated. He says all it does when you use fluoride for mouthwash or for toothpaste is you poison yourself and you don't get any benefit. He says water supplies should not be fluoridated. He says whitening agents are bleaching agents, and he doesn't like them, and he says they're very reactive, these chemicals, and he says you don't want to put those on top of your amalgams or they draw more mercury out of the amalgam. So people with amalgam should not use whitening agents, is what he felt. He says good to use reverse osmosis water for drinking and cooking. And I hope I showed you a good look at the book here. So I had a picture of it in my slide, and I think I briefly showed it to you, but here it is again, The Garbage Collector by Robert Gammal. Okay, the side effects of amalgam, the modern ones ever since 1976, the copper amalgams, they give off like 50 times more mercury vapor than did the older ones. You can put palladium into the mixture, but then the palladium itself is kind of toxic, so amalgams just aren't that great a way to go. The mercury especially inhibits mitochondria. It'll also decrease hemoglobin's oxygen carrying capacity, so it'll cause fatigue. You don't have good mitochondrial ATP production, you don't have good oxygen carrying capacity in your blood. That's associated with fatigue. It can cause neurologic symptoms of depression, cognitive slowing, anxiety, impulsivity, unprovoked episodes of anger and rage without any apparent reason. It can lead to tremors in the hands. It can actually go all the way to cause Parkinson's disease. It's associated with learning disability in children. Potentially lowered IQ. It's excreted in breast milk. It increases the risk of infertility, of miscarriage, of birth defects, and then a lot of major diseases, multiple sclerosis, Parkinson's disease, ALS, amyotrophic lateral sclerosis, and Alzheimer's. So it's a pretty bad thing. There's a good video he has a YouTube channel just called Robert. His name is Robert Gammal. And a nice video about rubber dam placement. As a matter of fact, I will link to that, rubber dam placement. That's a good video, and I'll make this the end of part 1 of Gammal dentistry. Hope you find it helpful.